Let's talk about the grand finale, the great show at the end of our menstrual cycle, which is our period. So menstrual fluid is not all blood. Some of it is cervical fluid. And then about 2/3 of our endometrial lining, the lining of our uterus, actually gets reabsorbed. So there's actually very little blood, even though it looks like it can be a lot at times. And then at that point, our body produces a little bit of anticoagulants, so substances that make our blood not be so thick and clotty. And so that further thins it out and liquefies it so it can pass easily. Now, clots with periods are normal, but there should be very few, and they shouldn't be bigger than a dime. When you have your flow going pretty quickly, so more heavily, you're going to see the bright red blood. It's when oxygen hits the blood, it becomes more dark. So when your flow starts slowing down a bit and it's exposed to more oxygen, then it can turn the dark red, and it can even look brown on our pads, just because of the oxygen, it's oxidation. Now, our average loss of blood during our menstrual cycle, if we have a normal cycle, is about 50 milliliters, 50 milliliters. And that is an average. If we are losing over 80 milliliters, then that's considered a heavy flow. A soaked pad or a soaked tampon is about 5 milliliters or 1 teaspoon of blood. And doesn't that seem like a small amount for what we see? It's kind of interesting to me. A soaked super tampon is about 10 milliliters or 2 teaspoons of blood. And so the average blood loss should be about 10 soaked pads or tampons, or about 5 soaked super tampons over that whole period. Our periods typically last about 3 to 5 days of bleeding with 1 to 2 days of spotting at the end, if it's normal. The way that we count our period is our day 1 is the first day of our heavy bleed. Not any spotting, that doesn't count. And then we count to our next day 1, and that's the length of our cycle. Stay tuned for more about what is a normal period.